Hi, I'm Dave Kaiser, and I'm with Pharmacogenomics Education. Pharmacogenomics, or PGX, is a newer approach to helping patients benefit most from their medications. It really looks at individuals' genetics, their DNA, and how they respond to medications. From the patient standpoint and helping them directly, we can decrease the trial and error prescribing that we see currently. We can put the patient on the right medication earlier in therapy so they benefit earlier. It also has to do with cost savings for the patient who doesn't have to pay for a number of different medications until they find one that works. You can see the medication classes where this is applied, and it's actually applied across many other medication classes also. But we see that anywhere from roughly 40% to over 75% of patients may not respond to a medication as we would expect, and then they have to try another medication. Another aspect directly with patients is to decrease adverse drug reactions. In a study that was published in 2023, and this was done in pharmacies, in ambulatory care clinics, in hospitals, so across many different settings, and importantly, again, in pharmacies, when pharmacogenomics was combined with some clinical information, adverse drug reactions were decreased by 30%. Now, think about the safety aspects for the patient primarily, but also the cost savings with emergency department visits, with other severe issues, and just the overall cost savings. And when we think about cost savings with pharmacogenomics, here's a really great example. This paper was published in 2022, and it's from a Northern Kentucky retired teachers union health plan. And pharmacists working with that health plan saved that health plan over $37.4 million over a 32-month period of time when pharmacogenomics was combined with drug therapy, monitoring, and medication management. So it's very important from an economic standpoint also. So pharmacogenomics directly related to the patient can increase drug efficacy, can increase drug safety. From a health system standpoint, decrease healthcare resource utilization. You can sell that to different organizations, increase cost savings, and increase revenue. Now, applying this directly with patients is appropriate where patients are self-payers, maybe through collaborative practice agreements with prescribers or long-term care settings where deprescribing may be important, and also, as I mentioned earlier, with insurers. The biggest barrier right now is with education. So we have an 8-hour ACPE accredited pharmacogenomics certificate program. I encourage you to take a look at that program, learn about pharmacogenomics, and let it work for you for your patients.